think it's absolutely true. I think people feel that they still have a lot to contribute. They don't feel that they want to sit back in that rocking chair at age 65. There's still so much that they want to accomplish, and they have the ability to do it. And in some instances, some of it is also another issue, which is people have not saved. They haven't really planned for their those later years, and in current trends with finances, people are having to work longer. But most people want to pursue their other dreams and possibilities for them.
Is it your perception, and I base this on conversations with nursing homes, I call them and talk with them, you know what they say? Our beds are all full. They're at capacity. Would you say that geriatric care provision entities are operating at capacity in general right now?
I would say yes, but the reason why is because like 25% of those people that's in the Erie County nursing home in reality could be in assisted living. So the challenge is
misapplication.
Exactly,
That's right.
exactly, and that's what we're getting at. And so if you really looked at the population and who's able in reality to go to assisted living, those numbers would be down a lot. Not only down, but the finance would be astronomical. Savings would be unbelievable.
Sure. We actually did a study, Project CODA, which is creating options for dignified aging, and it came out of the Berger Commission. So you're seeing that there were a lot of closures of nursing homes and a loss of nursing home beds. When we did a study, we took a snapshot of all of the nursing homes in Erie and Niagara County, and we found that they were between 97 and 98% capacity. We also found that, which exceeds the state level, that about 33 to 35% of the individuals in all of these facilities were at low acuity levels. So those were individuals who could move to a lower level of care if there was some type of option for them that was publicly funded. Most of these individuals are on Medicaid. There's no assisted living option for them. There's a shortage of those beds.
We've reached the point in the show called Call to Action. I'm making this up. He came up with Seasoned Americans. I should be able to do something creative. So we're going to talk about Call to Action. It sounds like you're calling for the American people to communicate to their representatives, their elected officials, that we need to start allocating resources a little differently towards assisted living models. And if we do that, how's it going to pay off?
Well, if just moving from our study alone, we showed that by moving those people from that Medicaid payment for nursing home to a Medicaid payment for assisted living could actually save about $1.7 million.
It's about a third as expensive, is that the number?
Yes.
To be in an assisted living versus
Right.
nursing? Because it would be like going to an emergency room for care. It's a very high-cost treatment modality.
Yes.
Exactly.
Many times more expensive than a primary care's office. Same thing here. Don't want to put people in a nursing home. They want to be in assisted living, and the quality of life is higher on the assisted living level too. But aren't the baby boomers such a how do I say this where it's politically correct?
Challenging.
They're not afraid to communicate what they want in a pretty loud manner. Do you expect the word will get through?
We're going to try. We're going to try. That's the purpose of what our project is to also have an education component in this community. And I think we've been partnering with AARP, which has been a great partner in making sure that we are able to change some of the public policies. And one of the great parts of working on this project has been that we've had the person from the State Department of Health Office of Long-Term Care, Mark Kissinger, be part of our steering committee. So they're really looking to us. So what we're doing here in Erie and Niagara County, are these things that then can be done at a state level, and are there things that they can change to really change the future?
What do some of the most progressive models for assisted living look like nationwide? Do you have any experience that you've read about something where it was just an unusual community that had shopping nearby and different levels you can move through? What's state of the art today in assisted living?
Well, that's true. There's certainly a number of different types of facilities. With all the things that you mentioned, there are people many times look for a continuum of care where they start out in an apartment level, they're very independent, functioning, and then as their needs increase, they can move through that continuum of care. That's a very popular model, but certainly there are standalone levels of care.
Are you excited about that model?
I'm excited about the concept that things are changing. They're not changing quickly enough. They're not adapting quickly enough.
You mean the whole nation's reaction to people wanting to be in assisted living versus nursing homes?
Right.
That's not happening fast enough?
No. Not here in New York State.
No. Okay.
Certainly not. That's not, just as Pam was saying. But in addition to the money savings there's a quality of life, not necessarily, I have a long background in nursing homes as well, and certainly there can be very, very good quality of life in nursing home care. It's all relative to what the person needs.
Do you really believe that?
I do. I absolutely do. I know it. I worked in it for 8 years.
The audience made me say that.
The
They
audience
spoke to me and
should have,
asked
they
and said,
did.
does she really believe that the quality of
You
life
know
in a
what?
nursing
There's
home is?
2 things, though, we have to remember. Number one is that we should have lofty expectations for our own lives, but we also need to be reasonable. Things are not without cost. People who work in the field need to be paid. I mean, there are costs associated with care and good care. But the workforce issue is one thing. People valuing the older population is what's going to translate into the right level of care. I know there could be
you
good
say that
quality
again?
of life.
People
People that are going to be in
Valuing.
the workforce. People valuing our older population are the ones that are going to be providing the great level of care. It's about people. People make up the system. And I agree with you that the State Department of Health is actively listening, and it's such a relief. So that's why I am hopeful. And I've seen people in nursing homes with very good quality of life. We should not impose our value on what a good quality of life is on another person. Because we're not walking in their shoes. So we have to listen to them.
Potential challenge here. You know, if we look at history, last 50 years, 2 groups have lacked empowerment: kids and the unborn, and the aged, or the seasoned. This is an issue.
It is, but as Pam said, I think what everyone's saying is that that we're hearing things a little bit more loud and clear. Wouldn't you agree?
Absolutely.
Yeah.
You know, there's also a movement here locally for person-centered care. Local nursing homes are actually looking at a couple of models that have been out there. You asked about exciting models. The Pioneer Network out there actually started focusing on making this facility, this is actually the person's home. This is their residence. And changing the shift so that we really focus on the person. And I think that's even part of what the Community Health Foundation has been focused on, according to the Institute of Medicine's 5 core competencies. Let's stay person-centered. What is best for that individual? And in some instances, it is the long-term care facility. They have no one else. This is a social environment which creates that next level of family for them, that provides that support. For those that do have caregivers, it might be supporting the caregiver and wrapping services around that individual so they can continue to provide the support.
Nancy, you said something very important, because you'll be surprised how many people that's in nursing homes that do not have family, and the other residents become their family. At the Erie County Home, we have chaplains on duty. I'm one of the chaplains there. So the spiritual aspect of the person is very, very important, because we are spirit, we live in a body, we have a soul, and many times we look at people just their medical needs, but what about their emotional needs? What about their spiritual needs? And if you can meet all of those things, then without a doubt, I think that's a quality of life. One of the initiatives that our administrator put on the table, as far as actually having one of our units as assisted living. Not only that, but building a smaller facility of maybe 325 beds and building housing to create what is getting ready to happen. So what's as far as a solution for the baby boomers?
Ladies and gentlemen, it's been a fantastic show. Thank you for joining us. I guess as more so than any other things, we will be in the soup we're making soon. So we want to have concern of these things, because it's us. See you again soon on Medical Matters. For more Medical Matters television shows, go online to medicalmatters.tv.